The Coronavirus Crisis, a live Fox 5 special with Governor Larry Hogan.
Stand by. And we welcome you into the State House in Annapolis, Maryland tonight. I'm Tom Fitzgerald. Welcome to this Fox 5 special, Coronavirus Crisis, a conversation with Governor Larry Hogan. Joining us tonight in the governor's office, we have the Maryland Superintendent of Schools, Dr. Karen Salmon, and the Deputy Secretary of Health here in the state of Maryland, Fran Phillips. We thank all of you for joining us tonight. And Governor, we thank you as well for making this possible. What we want to do tonight is get out of the way. To be clear about this, this program is yours. We want to be interactive. We want to be live. We've come up with a Fox 5 hashtag tonight. That is Fox 5 Ask Hogan. We want you to use that hashtag on our social media platforms tonight. Get those questions to us. We will turn those around. The governor and our officials here will do their level best to answer your questions. And Governor, I want to start with you tonight. You announced your initial steps in this crisis back on March 14th. At that time, you said this was going to be much longer and much worse than almost anyone's current understanding. Here we are 10 days later. Now, Governor, where are we? Is Maryland better or worse off than where you saw we were heading?
Well, so about 20 days ago, we had our first cases here in Maryland. We had the first 3 cases that were from an Egyptian Nile River cruise, and I said at that time that we declared a state of emergency immediately. And we've been messaging that kind of thing for really almost every day for the past 20 days, nonstop, because we've been seeing and hearing input from all of our top doctors and scientists, and probably seeing more information than the average person was seeing. But I tried to be as transparent and open as possible. I think we're continuing to see numbers that are dramatically climbing, which I predicted would happen, and I told everybody they should expect. We have a great team of people working really hard to fight this thing with everything we've got, and we've taken unprecedented steps. But it's going to continue to get worse before it gets better, and we got a lot of work ahead of us.
Governor, obviously one of the big topics of conversation today throughout the state of Maryland was the announcement on Maryland schools. And Superintendent Dr. Salmon, we have you here tonight. Can you walk us through the big question a lot of people have? You announced today that schools will not reopen at least until April 24th. But as you know, a lot of parents, a lot of students, a lot of staff are wondering, is this school year finished for now long term? What will be the deciding factor in making that decision?
Well, it's a great question, and it's a question everyone is asking constantly. I think we made the best decision possible today because we're giving time to get our continuity of learning back to our students. People are going to feel more, quote, normal in terms of learning every day, and our teachers are working really hard to put together information and packets and digital learning platforms for our students, working with our superintendents on an everyday basis. I think it is going to be a good 4 weeks. And then as we get more information, the governor's talked about this before, we have meetings almost every other day with our top doctors and epidemiologists, and we'll make a good decision based on their information and based on where we see our community spread.
So there's more to be determined from the data before we make that call.
Yes.
Yeah. Deputy Secretary of Health, we have heard conversation today from the governor of New York, Governor Cuomo, that he is very concerned about the amount of ventilators that his state has. What is the situation in Maryland right now, and what do you still need to meet this challenge?
Right, that is the question, to prepare for a surge, an anticipated surge. What kinds of medical facilities do we need? What kinds of staff? What kinds of equipment? And so with Governor Hogan's direction, we have collaborated across all of our hospitals, our health departments, and looking at the equipment needs, communicating daily with the federal government, so we have the kinds of reserves that we can draw on if and when we need that here in Maryland. We're looking at the other states very closely to see what their experience is.
All right, let's get to the questions from our viewers, because that's what this is all about. We're going to begin, Governor, with Bob Nunes. Bob was in Prince George's County today, and Bob had this question for you. So we're going to throw it up on the screen and let Bob ask his question.
I'm wondering if Donald Trump is being helpful to the state of Maryland. Is he being supportive, and does the governor support that we should get back to work or back in church by Easter? I think it's crazy, but I wonder what the governor thinks.
Well, so, I addressed this question earlier. Thank you for the question. Look, we're going to make the best decision. All of the decisions that we make are going to be made based on the real advice that we get from doctors and from scientists. Look, I think we're all hopeful. We'd love to be able to get back to work and back to school by Easter, but I think it's just unrealistic based on all of the data that we've seen. And I think it was not really helpful for the president to make those kinds of comments. I mean, on Monday he said we should be able to get back next week, and then yesterday he changed that to 2 more weeks at Easter. And I don't want to be critical of the president because I don't want to point fingers. We're all in this together at the federal, state, and local level, but we just can't make those kinds of statements. We're going to have to figure out this is. We don't have an exact date, and nobody, frankly, knows when we're going to peak and when we're going to be able to get back to normal.
All right, Governor, as you know, Fox 5 has been flooded with questions ever since we announced this live special last night. Shepherding that burden tonight has been Marina Morocco. She is live at Fox 5 tonight. And Marina, you have some more questions for our panel tonight from our viewers.
That's right, Fitz. Good evening, Governor. Today you announced that schools will be closed at least through April 24th. We have received a lot of questions about schools and online learning, and we want to start there tonight. Let's go to a question from a Montgomery County teacher.
Johnson, and I'm a teacher with MCPS, and I would want to know, how are you going to make sure distance learning is equitable for all students?
Well, I think it's a great question that we ought to direct to the state superintendent of schools, who talked about that earlier today and is really the expert and probably can address that better than I can. But we're certainly going to work very hard to make sure that everything is equitable, and we're working with our local school systems to make sure that that takes place.
Superintendent, let me ask you, one of the questions about the equality of that distance learning is the quality of the curriculum and also access to the internet and access to laptops. Where are we with that?
Well, it's amazing. I had a call with all the local superintendents today, and we listened to all of their plans, and I am just amazed at what they're doing. They are outfitting school buses with huge devices so that they can have 30 to 40 feet of internet for students to come up through their cars or bikes or whatever, but also appreciating social distancing. We have systems that are actually giving out individual laptops to our students, and these are all scheduled. We have elementary students are driving up to get their meals, and they're getting learning packets at the same time. So I would have to say that it's well coordinated. It'll get better every day. It'll get better every week, and we hope to provide a great 4 weeks of continuity of learning.
All right, well, thank you. Marina, I know there are more questions than that. What else do people want to know tonight?
Yeah, Fitz, maybe a follow-up there for Dr. Salmon. Any other academic year, especially in high school, the standards are rigorous across the board in Maryland. There's no question there. You add to that honors credits, advanced placement classes, international baccalaureate curriculum. Will those standards suffer and be compromised as these students now transition to distance online learning? And is their graduation in potential jeopardy because of this?
Well, those are really great questions, and I think I'll start with the advanced placement courses, and also the International Baccalaureate. International Baccalaureate has already announced that they will not have exams, so students will get the credit for whatever their course is. They'll be able to have that. The other thing about future advanced placement courses, they are designing advanced placement courses that can be given online, and that's great because they're not going to be they're not multiple choice. They're going to be have to do short answer and essay, and so we'll be able to get our students ramped up for that. If they don't have a device at home or don't have internet, our schools are going to be providing that access for those particular students. We also have to be very concerned about our students with disabilities because they need to have learning during this time too. So we're working very hard at our State Department with all of our special education leaders across the state to make sure that they're using creative ways to reach out and deliver those services to our most needy students. In terms of graduation, there's always hope. There's always creative ways to do graduation. And I put this question to the superintendents today, and I said, I want the best creative, out-of-the-box ideas going forward for some of these celebrations. And I think they'll come up with it if that comes to pass.
I take it that the intent
All
of
right,
the
well,
state...
we thank you for that.
Dr. Salmon, is to graduate as many students as possible in high school. Is there any sort of rubric as to how that can be done?
Well, we're working on that right now, but I'd like to think of it this way. I like to think of it that we've had pretty much three quarters of the school year, and that this last quarter, a combination of continuity of learning, and if we do get back to school, we can potentially add a couple of weeks if we need to. But I think we're looking at this as we're going to do the very best for our students. It may end up becoming a pass-fail quarter, and we bank a lot of what the students did on the first three quarters. But we intend to graduate students, and we intend to let students go on to the next grade level.
A big concern tonight for many parents, and that is the topic of tonight's Fox 5 Live Insta Poll. Education. We are asking our viewers, should Maryland and D.C. schools close for the rest of the academic year? And you can see there on the screen, 70% of the people who have voted say yes, the academic year should close out now. And of course, you can continue the conversation. Vote on our Fox 5 DC app on the browse section there, or you can weigh in at fox5dc.com. Fitz?
Yeah. All right, well, we thank you. Obviously, as we sit here in the middle of a pandemic, health is a major concern out of everybody. Social distancing practices that, Governor, you have been instituting and advocating. You also laid out some steps that you want Maryland taking. One of them, Assistant Secretary, is reopening old hospitals. You need more hospital beds. What do you see on the horizon right now for Maryland? You look at what's going on in New York City, and it gets your attention pretty quickly. Are we where we need to be in the state of Maryland on beds, and where are we at with reopening some of those old hospitals to increase the bed space?
Right. That's a great question. And we know that there's a likelihood that we will see a surge, a dramatic increase in people that need to be hospitalized. And some of those people will be in critical condition. They will need to be in ICUs, and some of them will need to be on ventilators. And so with regard to our hospital capacity, right now, all of the hospitals in Maryland are on alert. So they have reduced. In fact, they have completely canceled non-urgent elective procedures, so as to make way for hospital beds right now in hospitals that are available and fully staffed. In addition to that, we have looked at closed hospitals and looked at where we can immediately ramp up, put equipment in, bring staff in, and immediately ramp up into a couple of closed hospitals. Beyond that, looking at some of the surge planning with assistance from the federal government, looking at where we can develop alternative hospital sites, as well as looking at alternative ambulatory surgery centers and likely places where we can support people who maybe need some careful monitoring.
Where we're at right now is 420 confirmed cases, 423 cases.
423, that's right.
74 just in the last 24 hours. In your professional opinion, what does that tell you about what's going on in Maryland right now when we see such a spike like this in just a 24-hour period?
Well, Tom, you know, it wasn't that long ago that we were looking at people that had travel history, and we were tracking people that were coming into Maryland having been on cruises. That's not the case anymore. Those 423 individuals, most of them now clearly have been infected here in Maryland. It's community transmission, and so this is not unexpected. We see that this is a particularly infectious virus, and it's spread person to person, which is why the social distancing measures are so important.
All right, we want to get to some more questions. Marina's back at Fox 5 with that.
Many states are ordering shelter in place, others calling it a lockdown. Governor Hogan, today in your briefing, you called this semantics, but still Maryland residents are asking for clarity.
Hi, my name is Maria Reese, and I am from Gaithersburg. My question for Governor Hogan is, will there be a mandatory lockdown? The reason for my question is because I work in the healthcare setting, and we are seeing a lot of non-emergency patients coming in, being exposed to coming into a medical building. And I believe that with the lockdown, people will stay home and not put us at risk and put themselves at risk. So that would be my question for you, Governor.
Yeah, well, thank you very much for the question. So different states are taking different actions based on the facts on the ground. There was one national survey that said the steps that we took are actually far more restrictive and more aggressive than 48 other states in America. So while we said people should stay in their homes unless they absolutely need to leave their homes. We also closed all of the non-essential businesses in the state. We put restrictions on access to healthcare facilities more than a week ago, almost 2 weeks ago now, with respect to our assisted livings and our nursing homes, and then a week ago with our hospitals. So we're limiting access to those kinds of facilities, but we're also having more success with people staying in their homes by without calling it a mandatory lockdown. We're actually more restrictive than most of the states who have said that they're locking people in their homes. We're allowing people to leave, with proper social distancing, with groups of less than 10, and getting out to do the essential things that they need to do. But actually, we believe that the steps that we've put in place, and other people have said the steps we put in place, are much more effective and much stronger than what they've done in most other states in America.
And Governor, you even said in your briefing today that you've had very few instances of law enforcement having to break up large groups of people. Does that tell you that these messages have been getting across to Marylanders?
I think they are, Tom. So at first, we came out, a week, 10 days ago with telling people that they should, and they didn't really listen. And so then we had to take more drastic actions, and we started closing businesses down and being more aggressive. But now everybody seems to be, through shows like this and through all of the attention, people are home and watching the news. People are starting to understand how serious the crisis is, and people are listening. Very few cases of people violating. I think 14 cases in the entire state, with all local and state law enforcement, where they had to break up a crowd of more than 10 people.
Marina, let's throw it back into you.
Governor, folks with no health coverage, as you can imagine, are very concerned. Here's another question via Twitter. Does Maryland have any free testing centers for those who are without health insurance?
So it's a big concern. I know that a lot of Marylanders are having. It's something that we're trying to address at the state level, and also the federal government is addressing, and it's part of the actions that are being taken in Washington. But I'll let maybe Fran Phillips, our Deputy Secretary of Health, talk about testing in particular, but we immediately took actions right away to try to address some of those issues. But testing, people that shouldn't be getting testing should not be out. It's only a certain limited number of people should be taking these limited number of tests, but they shouldn't have to pay for it no matter what their insurance situation is. And I'll let maybe Fran Phillips discuss that a little bit more.
Sure. Thank you, Governor, and that's a great question. The issue of testing is a complicated one, as the Governor said. The supply isn't what it should be. We're working very hard to build up the lab testing capability. But here's the bottom line. People that don't have symptoms don't need to be tested. And that's important in order to preserve the tests that we do have for people that have symptoms, and particularly people that are vulnerable. So that would be people over 60, people that live in group homes, for example, people that have underlying conditions. And testing is something that needs to have an order from a physician. So make sure, if you think you have symptoms, check in with your healthcare provider in advance of thinking about testing.
Secretary Phillips, what are you hearing from your professional colleagues, though, about where the tests are? Because much like the questions about the need for ventilators, there has been a widespread nationwide need for tests. Are those coming online, and are they going to be available soon in a wider
Sure,
sense?
Tom. The testing that is online now is better than it was, and it's not good enough. So we in the state, we have a state lab. There are commercial labs that provide testing for physicians' offices, and slowly our hospitals are building up their capacity in their own labs to do testing. So we expect that will continue to grow, but that's a tough path with the kinds of shortages that are required.
All right, let's get to more questions. Marina.
Follow up here for Deputy Secretary Phillips. With a shortage on masks for health professionals, people are asking how can they help? This question comes from College Park.
My name is Simone, and my question for the governor, I understand that there is a shortage of supplies. Would they be open to average citizens helping out to make maybe gowns for hospital staff or masks? Because I definitely know there's people that have those skills. So would they be open to members of the community assisting in that effort?
You can take this too.
Well, thank you very much for that question. One of the wonderful things, I mean, there's a lot of terrible things about this crisis, but one of the wonderful things is that so many people have stepped up to volunteer, and we have a website called Maryland Unites, and you can go on there and see all the different opportunities there are to get involved to help, and some of the things you just mentioned are possibilities. We have small businesses and individuals who are helping, but shortages of masks and other equipment, some of them, they're very specific requirements and regulations that we have. It's not just anybody can go out and make a mask, even though it sounds pretty simple. But there are a lot of incredible things that you can do. Some of them as simple as giving blood, because we have a shortage at the Red Cross. Some of them are just volunteering to get a meal to some older residents. But masks are continuing to be a shortage, but we have small businesses and large businesses and individuals stepping up to try to help with that. And I don't know if, Fran, do you want to touch on that at all?
Right. Well, it's very, very important that healthcare workers, people who are taking care of us, are properly protected themselves so they don't get sick. And so working through local health departments around the state, when we get shipments from the federal government of that material to protect healthcare workers, we send that out right away so that the local health departments then can distribute to hospitals, nursing homes, and for example, EMS workers.
All right, we want to switch focus from the area of health to the area of the economy. Obviously, none of us in our lifetime has ever seen anything like this. The entire American economy shut down. Obviously, this is going to have a devastating impact on the economy in Maryland, which has been, of late, doing quite well. So there's a couple of concerns, and one of the things we've heard over and over again from folks is unemployment. They are not able to go to offices right now because of the social distancing we need to do. People have said that they've had difficulty getting to websites, getting people on the phone. Governor, what can you tell folks tonight about what is in the pipeline, even if we don't exactly know what's at the end of that pipeline, as far as getting Maryland's economy back up and running at some point?
This is a very important question, Tom, and thank you for asking. So we're fighting these two battles at the same time. One is we're trying to save people's lives and keep people safe, and it's an enormous crisis that we've never faced anything like this before. But we're also worried about all the people who are out of work and those small businesses and the people that are faced with not getting a paycheck. We're trying to address both of them, both at the state level and the national level. So here in Maryland, we've taken a number of steps. First of all, we're one of the few states where you can automatically file for unemployment the day that you don't have a job. You don't have to wait for a couple of weeks. There's enormous volumes because of so many people. So getting on the phone is difficult. It's better to just go online and do it because people can do it from home, the people that are teleworking, and they can respond to you in order. So you go, that's a better way to do it than trying to wait online on phone. The federal website is actually crashing because there's so many people. So our site links to the unemployment, the federal site, and that's a problem we're trying to get fixed. But in Congress, they're still fighting to try to solve an issue there in Washington that hopefully will be resolved tomorrow or the next day. We've taken steps at the state and the federal are both trying to address this because we've got to get people back to work. We've got to make sure these small businesses don't go out of business, and it's something we're very, very focused on and have been from the beginning.
And apparently there's another holdup on the stimulus package tonight, which senators are still working. Let's head back over to Maria.
And Governor, you briefly just touched on this. Obviously, there's no definitive end date in sight to this coronavirus crisis. People are out of work, unclear when their next paycheck will clear. Here's a question from one of our viewers tonight.
Good afternoon, Governor Hogan. This is Denise from Silver Spring, Maryland. My question is, are you planning on pausing the rent and mortgages since a lot of people are losing their jobs?
Yes, as a matter of fact, that was one of the first things we did with an executive order more than a week or so ago. We signed an executive order where no one can be evicted, no one can take action against anybody on rent or mortgages or their utilities, and they can't charge any late payments. The federal government followed just, I think, a few days ago with similar kinds of actions. I mean, there's through no fault of your own, you're put in this situation where you can't work and can't then pay your bills. So the state and federal government are going to do everything they can to make sure that we can do whatever is possible to protect people in that kind of a situation.
Governor, this question now coming from Rich on Twitter. Again, you briefly spoke about this, but this is his specific question. People I know have been having trouble getting through to the unemployment office, especially those whose period of eligibility had expired before the pandemic. How can those people who became unemployed again due to the pandemic file for unemployment?
Yeah, so I just mentioned that a second ago. Because of the unprecedented volumes, which are, maybe, 100 times or 1,000 times higher than normal, and the fact that because of the shutdown, we've forced state workers to go into teleworking. And the phone systems are crashing and overloading, so the best way to go is online. Our system has been ramped up and upgraded. Unfortunately, the federal system that we tie into for the unemployment benefits is crashing, which we're trying to get them to address. But the best way is to do it by email and or going on the website, which is not crashing anymore, and instead of waiting on a phone call, which is difficult because people are not working in their state offices due to the same reason other people aren't working in other offices.
In a situation like this, Governor, in this pandemic, facing coronavirus, your natural inclination, or anybody's natural inclination as a human being, you want to try to look for the good news. But clearly, there's no way to look at what's gone on here as good. So let's look down the road at a bit, though. There are some things that are going on in this state right now that we need to point attention to, because there is a spirit that we see out there, which, not all that long ago, people would have questioned whether we were able to garner that. So what's next in your view? Where do you see us going right now?
Well, so Tom, actually, in spite of how bad things are, and this is, I think, the worst thing that any of us have ever had to deal with, there are some really great things going on. I mean, we have a couple of incredible women here who are leading incredible teams. There are thousands of people that are working around the clock to get things done, but just tens of thousands of Marylanders who are stepping up to help their neighbors. We really are coming together. So when something bad like this happens, it brings out the best in people. And so that's one silver lining. The other thing that's good is finally in Washington, we're seeing real bipartisanship. I mean, it looks like we're actually getting things done in Washington in like 1 week's time instead of waiting years with nothing ever getting done. So there's some positivity. I can't promise people like there's this Easter deadline or things are going to be done, but I do know that if we all come together, we're going to get through this together, and things are going to be better. We're going to go through a tough time, but I think hopefully it's going to bring us all together, and if we help each other and we're all in this together, that I think we're going to come out of it stronger than ever.
You got to pay attention to what's going on, but also keep your eye on the ball down the road, because there are some good things going on in our community right now. Very good thing. Marino, send it back into you.
Governor Hogan, there's been a lot of questions about how Governor Northam of Virginia has made his decisions in regards to this pandemic. Whatever happens in D.C. and Virginia inevitably could affect Maryland. Here's a question about your influence with other state leaders.
Sarah Feinberg, Silver Spring, Maryland. My question is, as the head of the National Governors Association, what are you doing to influence your fellow governors around the country to make their state safe so that people aren't spreading the disease beyond the borders of our state, which you're doing a great job on, but how are you influencing others around the country?
Well, thank you very much for that question. So yes, well, first of all, in the region, we're having ongoing conversations with both Governor Northam and with Mayor Bowser about things that are going on in the Washington metropolitan area, and I think we're all pretty much in sync now. While there might be little differences in the district or in Virginia, all of us are taking unprecedented action, and we're now pretty much on the same page with a few minor differences here and there, and we're communicating very, very well. Our teams are talking together every day. In the National Governors Association, we had another meeting today with nearly all of the governors. It's our 7th one in a little over 2 weeks. We've had 5 of them with the president and vice president and the senior teams in the federal government, and it's really one of the things that I think is a terrific thing, that Democratic and Republican governors all across America are working with no partisanship whatsoever. I've got governors calling me all day and night asking for advice and input about what we're doing here, and we're sharing everything back and forth. And I think governors are really stepping up and working together, and we're all in this together, and I think it's a terrific thing.
Governor, we got about a minute left. As we wrap up here tonight, you are somebody who has faced adversity in your own life. You had a very serious medical scare very early on, facing cancer. You had violence in Baltimore, which you had to tackle. How did that inform you on what we need to do in this state right now as we approach this crisis?
Well, my own personal situation, I guess I have a pretty strong faith, and I'm a very positive, hopeful person, which I think is probably good for everybody at this point in time. And I know that we can get through tough health scares. But on the crisis in Baltimore, I mean, just making quick decisions and taking action, I think I learned a lot from that.
And that's what we've seen so far. Governor Larry Hogan, we thank you so much for talking to us tonight. The Superintendent, Dr. Karen Salmon, joining us as well, too, and the Deputy Secretary of Health here in the great state of Maryland. We thank all of you. We thank you as well for spending this half hour with us here on Fox 5. Marina?